Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Avazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi, everyone. Welcome to the Egg Whisperer Show. I'm Dr. Amy, your host, and I'm so excited to have a wonderful Bay Area fertility doctor, Dr. Meera Shah, on today's show. Hi, Dr. Meera.
Hi, Dr. Amy. Thank you so much for having me on.
You're very, very welcome. It is truly our pleasure, and I know our audience is going to really enjoy today's topic. The topic of today is ethnic disparities in reproductive health and IVF outcomes. And before we get into that topic, I want to read your bio. It is so impressive. I love having fertility experts on my show because you guys are inspiring and you do such amazing work. You're double board certified in OBGYN, reproductive endocrinology, and you're a fertility specialist at Nova IVF in Mountain View, California. You're a Bay Area transplant. We were just talking a little bit ago. You originally are from North Carolina and you went to UC Berkeley, followed by a fellowship year at the NIH where you did basic science research in neuroendocrinology. You went to Stanford for medical school and completed a residency in OBGYN at UC San Francisco. And then you came back to Stanford for your fellowship. And during your fellowship, you published a lot. Subject areas ranging from fertility preservation to cancer, pregnancy loss, reproductive genetics, and on the topic that we're talking about today, ethnic differences in IVF. You joined Nova in 2017 after your fellowship, and you continue to engage in medical education with the Stanford community. And I'm so excited to have you here. Thank you.
Thank you.
So tell us about your practice.
Sure. Well, first, I just wanted to thank you for the opportunity to be on your show and reach out to this audience. I have so much respect for you, Dr. Amy, and the practice that you've built. So again, it's an honor to be on this show. So as you mentioned, I also practice in the San Francisco Bay Area. My practice is Nova IVF, and we're based in Mountain View. And I have one practice partner. We specialize in really personalized IVF care, really providing exceptional patient care, just like you.
Awesome. And I'd love to hear, why did you go into medicine? And more specifically, why fertility medicine?
Sure. So to be really honest with you, I took a leap of faith because I am the first physician in my entire family. Didn't really have many role models, but my parents were immigrants to the U.S., and so I'm a first-generation Indian American. So they instilled a lot of really important values in me that allowed me to excel academically and open a lot of doors that really, helped me as a young, impressionable woman. So choosing medicine really happened for me the year after I graduated from UC Berkeley, and I got to spend a year at the National Institutes of Health where I was doing bench research, and while I enjoyed it, it just wasn't the right fit for me. I really enjoyed the bench to bedside translational medicine idea that we could directly take these concepts in the lab and affect and improve patient care. So I applied to medical school that year and was so fortunate to land a spot at Stanford University. At Stanford, I met my future husband, who's also a physician, and I found incredible mentors who really paved the way for me to find a passion in women's health. So I completed my OBGYN residency at UCSF. And I just found at that time that the field was so vast, and it really made me think about the desire to subspecialize and become an expert in something. And while I loved the scope of practice in OBGYN, I mean, we get to really be involved in the most intimate aspects of women's lives, whether it be discussing sexual health, contraception, pregnancy, menopause, cancer. I mean, that was incredible for me, but I really felt like it was too much. So I wanted to specialize. And I found that in reproductive medicine, that I could be challenged intellectually, I could have incredible continuity of care, the variety of procedures that we get to do day to day is incredible, and ultimately what we get to do, which is to help couples fulfill, arguably one of the most important purposes in their lives, to build their own family, was the most gratifying thing I could ever consider. So I'm so honored to be in this field and practicing with people like you and have colleagues like you. The last thing I just wanted to say is that, my own personal path to parenthood was anything but straightforward. And, I had, like many of our patients and people in general, I found that there were a lot of roadblocks along the way. I had recurrent miscarriages, and it really challenged me to sort of think about what it's like to be on the other side, of the table as a patient. And so through those life experiences, I really gained a lot of sort of perspective on what it's like to go through this. And it's allowed me to really have an appreciation for what we do in our field.
Wow. Well, thank you for sharing such a personal story about yourself as well. Your patients are so lucky to have you as their doctor. So I want to go into the questions for today's topic about ethnic disparities. The first question is, what ethnic differences exist in women's overall reproductive health?
Great question, Dr. Amy. So let's start with the beginning of the reproductive spectrum, which we define as menarche, which is the age of onset of a girl's first period. And so even as early as this, we do see some differences amongst different ethnic groups. And so most girls will undergo their first period around the age of 12 and a half. But some studies show that African American and Hispanic girls actually undergo menarche at a younger age. And similarly, Caucasian girls will undergo menarche at a later age. And so this was really interesting, and there may be many confounders that might explain this, including the incidence of obesity amongst young girls. And, this wasn't looked at very clearly in these studies. So that needs to be investigated more. However, these findings are very interesting. Similarly, on the other end of the reproductive spectrum, when we think about menopause, there are some differences as well amongst ethnic groups in the age of onset of menopause. And so what they found, again, is that Black and Hispanic women underwent an earlier onset of menopause as compared to white women. And so this is really interesting, and we can talk about this a little bit more later, but menopause is definitely linked to cardiovascular disease and osteoporosis. So for these ethnic groups, undergoing menopause at an earlier age confers a higher risk for those conditions as well. So when we talk about other things that pertain to reproductive health, one of the important things that are very strikingly different amongst different ethnic groups is the incidence of uterine fibroids. So fibroids are essentially overgrowth of the muscular part of the uterus. And for Black women, there is actually a threefold higher incidence of uterine fibroids. And we know that fibroids can affect everything from fertility to heavy menstrual periods. It can affect pregnancy outcomes and miscarriage risk. So this is a really important thing that we have to think about when we're evaluating women of African American descent. We need to really evaluate for whether they have fibroids. And the last thing I wanted to talk about was polycystic ovarian syndrome. This is a very common condition, and the prevalence can be as high as 15%. As you know, it's a very heterogeneous type of diagnosis, and the clinical presentations can vary widely. So it's not clear from the data that we currently have that there are differences amongst ethnic groups, but what we do know is that it's often misdiagnosed. And one of the clinical criteria is actually the presence of facial hair, which we know is more common in certain ethnic groups, but it's not necessarily linked to an androgen excess, which is something that's particular to the condition of PCOS. One thing that we do know, however, is that the severity of PCOS can actually differ amongst different ethnic groups. So one study actually found, interestingly, that Hispanic women had a more severe phenotype of PCOS as compared to Caucasian women, and they actually manifested some of the androgen excess symptoms and metabolic manifestations of PCOS in a much more severe form as compared to the control group, which was white women. So there's some interesting things. Again, a lot of limitations to these studies. It warrants further investigation, but nevertheless is interesting.
It is interesting because sometimes you might think something's abnormal, but the reality is it's actually quite normal for you. And a lot of the studies might say that it's abnormal, but maybe the population they study doesn't represent you precisely. Are there also ethnic differences in men's reproductive health?
This is a very interesting question as well. So there are some very small studies that suggest that there might be some ethnic differences in things like semen parameters, testicular architecture, and male factor infertility. However, again, there's not a lot of data out there, so we can't make any conclusive statements. Something that I found really interesting was when they were looking at using androgens as a potential male contraceptive, they actually found that the ability to induce azoospermia, so completely remove the presence of sperm, was only about 60 to 70% in Caucasian men. However, in Chinese men was over 90%. So that was really interesting. And there might be some slight variations within the Y chromosome genetics that potentially could explain some of these differences. Again, we don't really fully understand that. It hasn't been studied well. But again, there might be an underlying biological process that's explaining some of these differences.
And then the next question would obviously be, would those differences mean differences in infertility based on your ethnic group?
Yes, so this is really, really an important question. And what we know, generally speaking, is that infertility is a global problem. It doesn't discriminate against ethnicity, race, or religion. And, there's obviously many causes for infertility, so I'd like to break that down. And I thought I'd use your creative acronym, Dr. Amy, the Tushy method, to talk about these causes and talk about how each of them might be different in regards to different ethnicities. So just to review your method, and I hope I get it right here, but Tushy stands for T, the tubes, U is uterine factor, S is the semen parameters, H is for hormones, and Y is your genetic profile. Did I get that right?
That's perfect. And I might admit, I might cry a little, the fact that you're just talking about it right now. I love it.
So we'll talk about T first, which is the tubal factor. And obviously the tubes are very important for natural conceptions, and many things can cause abnormalities within the fallopian tube, whether it be prior pelvic infections, endometriosis we know can cause tubal factor, or scar tissue from other abdominal and pelvic surgeries. Let's start with endometriosis. Endometriosis, as many of you know, is an inflammatory condition in which hormonally active cells that are normally supposed to be inside of the uterus, they sort of find themselves outside of the pelvic cavity. And it can cause scarring, it can cause blockage of the fallopian tubes, and that's how it can cause a tubal factor. And an interesting study that was part of the Nurses' Health Study actually found a higher risk of endometriosis amongst white women compared to Black women. And actually, even more striking was amongst Asian women, there was a 6 to 8-fold higher increase of endometriosis compared to white women. So again, these findings are interesting. One of the limitations to doing any study with endometriosis is its diagnosis. It has to be made surgically, and it's a pathological diagnosis. So it's often misdiagnosed or underdiagnosed. And there could be potentially other explanations for these differences, but at least from the data that we have, it does appear that there might be some differences amongst different ethnic groups. But overall, we do know that tubal factor is actually more common in Black women, and this is likely secondary to higher rates of pelvic inflammatory disease, which is primarily caused by chlamydia and gonorrheal infections. So that's the tubal factor. We'll move on to U, which is the uterus. And we talked a little bit about Black women having a 3-fold higher risk of uterine fibroids. That certainly can cause problems with getting pregnant and implantation. It can cause issues with miscarriage, oftentimes later onset miscarriages, and other pregnancy-related complications. We also know that obesity is well documented to be negatively associated with pregnancy outcomes and pregnancy-related complications. And, this may be related to a number of different mechanisms. Primarily, one of them is ovulatory dysfunction and menstrual irregularities, which can impact, the uterine lining shedding process. And so what we do know is that it can, affect fertility by affecting the process of ovulation, but actually, more importantly, kind of over time, if the lining is not shedding at regular intervals, it can cause thickening. And that thickening can over time cause endometrial hyperplasia, which is kind of an overgrowth and a dysplastic process of the lining, which can be a risk factor for uterine cancer. So it's really, really important to be evaluated for a woman who has irregular cycles, especially if it's been ongoing for a very long time. And unfortunately, we know that obesity affects different ethnic groups differently, and it is much more common in Hispanic and Black women. And it's likely multifactorial. There could be dietary, behavioral, genetic, socioeconomic factors, but the reality is that it's something that we need to address. It's a public health issue. In terms of S, in the Tushy method, sperm factors, so we talked a little bit about that. There may be some differences related to underlying genetic differences in the Y chromosome. Again, the jury's still out on that, so we need to do some more research. H, so H stands for the hormonal profile, and one of the markers that we use a lot in assessing fertility and ovarian reserve is the Anti-Mullerian Hormone, or AMH. And in 2013, there was actually a really interesting study, and it was published just down the street from us at UCSF. And they were actually looking at whether AMH differed between different ethnic groups. And what they found is that Black women actually had lower AMH levels at a younger age, but they experienced less of a reduction of AMH with advancing maternal age. So that was a really interesting finding. What they also found in that study is that Hispanic and East Asian women compared to white women may actually have lower AMH levels. So that might indicate that they have lower ovarian reserve and might be, less responsive to IVF hormones. So that's really interesting. And that might put them at risk for earlier onset menopause, which again, as we talked about, might have not only implications for their fertility window, but also implications for their long-term health as it relates to their cardiovascular disease risk profile, as well as their osteoporosis risk profile. So really, really interesting findings in terms of hormone profiles. Lastly, with the Y stands for your genetic profile. And so I wanted to just briefly highlight that, in our field, we do a lot of preconception screening. We have this really unique opportunity to optimize women's health and optimize for pregnancy health. And one of the tests that we often order is a carrier screening. And that's something where we can identify whether couples are at risk for having children with specific types of recessive genetic conditions. And so the American College of OBGYN has recommended ethnicity-based screening, which are essentially specific panels for women and men of specific ethnic backgrounds. So for example, couples of Ashkenazi Jewish descent are recommended to undergo additional screening for specific diseases that have a higher carrier allele frequency in that group. So diseases like Niemann-Pick and familial dysautonomia, cystic fibrosis are higher, and so those panels are recommended for those ethnic groups. So that's kind of an overview using the method and sort of how different ethnic groups differ in terms of the individual causes of infertility.
And what about miscarriage rates? Are there also differences among ethnic groups when it comes to that?
So there was a really interesting study that looked at over 38,000 fresh cycles of IVF. And what they did find was that Black race was associated with a higher risk of miscarriage compared to being white. And this was about a 7% difference. Interestingly, though, most of the miscarriages were in the second trimester. And when we talk to patients about the causes of miscarriage, we talk to patients very differently when we're talking about a miscarriage that occurred very early in the first trimester versus the second trimester. We generally think about genetic causes of miscarriage in the first trimester versus we think more about systemic conditions, structural causes, infection in the second trimester. So what they found is that most of the miscarriages that were occurring in terms of really explaining that difference were in the second trimester. So it might be interesting to look into that pathophysiology a little bit more to really understand that, and there's ongoing research in that area.
So what about the IVF outcomes? I mean, you talked about miscarriage rates, and that was
Mhm.
pretty profound what you just shared with us. But IVF outcomes and ethnic differences?
Yes, so there are some very, very striking differences in IVF outcomes among different ethnic groups. And one of the studies that combined, over 5 US registries, so a very, very large cohort of women undergoing IVF, showed that women of Black, Hispanic, and Asian descent had lower clinical pregnancy rates as compared to white women. That particular study had a few confounders. They didn't account for the infertility diagnosis. They didn't account for miscarriage rates, obesity, and they also included multiple cycles for the same patient. So that study had some inherent flaws in which we can't really interpret the data completely. However, there were a lot of subsequent studies that actually did as much as they could account and adjust for those potential confounders. So I'm going to outline a few which compared specific ethnic groups. The first, comparing Black and white women. They actually found that Black women had a 24% less likely live birth rate as compared to white women with their first cycle of IVF. So pretty striking. And that was actually followed up in a larger study which looked at over 200,000 IVF cycles. And they found similar findings. And again, these studies adjusted for age, BMI, socioeconomic status, really as many factors that potentially could have impacted the outcome here. So there might be some underlying genetic factors, but again, that needs to be elucidated a little bit more. Now with East Asian women, there also have been some studies comparing Caucasians and East Asians. Most of these studies were actually done at UCSF. And there was a great study that actually looked and adjusted for the type of protocol, IVF protocol, the dose of gonadotropins, the number of follicles, the number of eggs retrieved. And they did find that East Asian women, as compared to Caucasian women, had a much lower live birth rate. Interestingly, they found that the peak estrogen levels in these East Asian women was much higher per follicle. And one of the potential explanations for that might be genetic variants, or what we call polymorphisms in the receptor for FSH. That's a really interesting thing that we need to look into more. But again, lower live birth rates, and something that we need to look into more. There was and I've taken particular interest amongst South Asian women. There were some studies out of Stanford University before I was a fellow there, which looked at clinical pregnancy rates comparing South Asian women to Caucasian women. What they found was that Caucasian women actually had higher live birth rates in fresh cycles. And these were cycles that all transferred blastocysts, and they tried their best to adjust for all the confounders in addition to adjusting for the embryo quality. Now, when I joined Stanford as a fellow, I was really interested in looking at whether that relationship held true in frozen cycles. One of the really unique things that you can remove as a potential confounder in a frozen cycle is this idea that endometrial receptivity could potentially impact the outcomes in a fresh cycle. So we looked at a cohort of women, South Asian versus Caucasian, in just frozen cycles, transferring a single blastocyst. And what we found is that while we saw differences in fresh cycles, that was completely eliminated in frozen cycles. So actually the live birth rates were completely the same in both ethnic groups. Really, really interesting finding. We postulated that this might have really been explained by differences in endometrial receptivity that we see in fresh stimulated cycles as compared to frozen cycles.
And what about in donor egg IVF? Are there ethnic differences in those types of cycles?
So again, we don't have great studies to really make conclusive statements. However, I will share with you some of the few studies that we do know about that have been published. And one of those studies was performed in Spain, and it compared recipients that were Black compared to recipients of egg donors that were white. And they found that there was a 40% decrease in their rate of ongoing pregnancies among Black women. And they did adjust for things like tubal factor, uterine factor. However, it was still a limited sample size. And that hasn't been corroborated in other studies as of yet. The other thing that they looked at, and this it relates to the actual ethnicity of the egg donor, But when egg donors were of East Asian descent, they actually found that they had lower ovarian reserves. This might go back to what I mentioned earlier about them having lower AMH levels as well. And so while they didn't respond as well in terms of their oocyte yield, the actual live birth rates were similar amongst the intended parents, but there were some differences. And, on a slightly related note, I just wanted to talk a little bit about, how in, the region that we practice in, Dr. Amy, we see a lot of very diverse patients. We have a lot of South Asian, East Asian patients. And I know you probably experience this as well, but it's really hard to find donors that have similar ethnic backgrounds. And I think that we need to explore a little bit more the attitudes of these young women in sort of considering volunteering to be an egg donor, and why it is so hard, for people who are looking for Asian donors to find them, and sort of explore a little bit more about that.
Yeah, that's a great point.
Yeah.
So we know that there are a lot of healthcare disparities that exist. What are they, and what can we do, especially as fertility doctors, to change that?
So yes, this is very unfortunate that there are very large racial and ethnic disparities that exist across the country. One of the things we know in general is the utilization of fertility care is much higher amongst white women as compared to other minority groups. And we also know, and I certainly experience this in my practice too, that minority ethnic groups, take much longer to actually come and see us. The duration of infertility might be a year or two later, and that certainly can impact not only how well they do with treatment, but also just their psychosocial sort of perspective on the whole thing. So I think we need to do a lot in terms of destigmatizing infertility, especially amongst these minority ethnic groups. We know that cost is a huge, huge barrier, and the cost of IVF might potentially exceed 50% of one's household income. So we know that, this is a huge barrier, and it might be potentially more of a barrier amongst certain ethnic groups and women of lower socioeconomic status. And, interestingly, we know that, even amongst states where infertility care is mandated, so you're potentially even removing the cost aspect, that cost burden, we are still seeing disproportionate access to care. So there's so much room for improvement. And I personally believe that one of the first things that we need to do is just diversify our workforce. I mean, it's great to see that this new generation of fertility specialists are women of color, women of ethnic backgrounds like our own. Patients need to see doctors that look like them, that have similar cultural backgrounds, that understand the stigma and the taboo of infertility. One of the things that, I see a lot in my practice is a condition called vaginismus, which is a condition where essentially women are unable to have penetrative intercourse because it's so painful for them. And so much of that is psychological. And I do anecdotally just find that to be much more higher amongst my South Asian and East Asian patients. And I think that relates directly to the taboos around sexuality and being comfortable with your sexual health. And so we just, need to work on that and really educating women on their bodies, on their anatomy, on sort of just really removing some of these stigmas and taboos around infertility. But I think diversifying the workforce is really going to be one of the key ways to do that. Of course, I think we're doing our best to increase, coverage, financial coverage for patients. And we're fortunate, Amy, to be in the Bay Area where a lot of tech companies provide fertility benefits, but that's not the case in the rest of the country. So, states really need to take that on as their responsibility to provide more coverage. And there's a lot of states that do, but there's still a lot of states that need to jump on that bandwagon. And, I think finally what we do a lot of, and sort of the purpose of this session is really just education. We do that through having these Q&A sessions, through Instagram and social media. But I think we just need to educate women on these topics, and, knowledge is power. So the more that we can educate women, I think the more that they're going to feel like they can access care, understand and feel empowered to ask the right questions and get the information they need to make informed decisions.
Well, I certainly feel a lot more educated on this topic after hearing you talk about all of this stuff, and I hope our listeners learned as much as I do. Thank you for coming on today's show. So where can our listeners find you if they want to see you as a doctor?
Again, we practice at Nova IVF. So our website is novaivf.com. I also I started an Instagram profile where I do a lot of education on fertility topics, and my handle is at Dr._Meera Shah. So you can find me there as well.
Awesome. Is there anything else you want to share with our audience before we sign off today?
The only thing I want to say is that, in general, the fertility journey can be a very long and circuitous path. And so, finding the right providers, finding the right clinic that really helps you achieve not only your reproductive goals, but helps you stay positive through those highs and lows. I think you do an incredible job of that. And I unanimously hear from your patients that, Dr. Amy was one of the most positive people that they encountered. And, I think that just finding that cheerleader, that coach, that person who's going to help you through the inevitable highs and lows of the journey is really, really important. Again, as someone who has been through it, who has had personal challenges on my own road to parenthood, my best advice to all of you is, again, find that provider that you click with, that you fit with. But through that process of going through fertility treatment, don't lose yourself. There are things in life that should still provide you joy, and find those and continue to do those things. And, practice self-care. I can't say that enough, but I think it prevents burnout as women go through fertility treatment, and can ultimately help couples find success in their journeys.
Thank you so much for that. That was really, really powerful. And thank you for all your time. Thank you for all the research you do. And that I hope people follow you on Instagram and learn as much as I do from your posts as well.
Thank you so much, Dr. Amy.
Okay. Well, thanks guys for joining today's show. Please don't forget to subscribe to my YouTube channel, and be sure to take either my IVF class or Tushy class at eggwhispererschool.com. Thank you, everybody. Have a great day. Bye, Meera.
Bye.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Ivf Outcomes.
And you have yet another success story.
Just launched by an East Bay fertility doctor.